Yes. Good afternoon, friends. So I welcome you on today's lecture, which is 31st in the series. The title is Regulatory Framework and Guidelines for Management of Nuclear and Radiological Emergencies. Our expert talk is by Dr. S.P. Lakshmanan. Dr. Lakshmanan is our scientific officer, grade F, Atomic Energy Regulatory Board in Mumbai. Dr. Lakshmanan is a Masters of Engineering Mechanical from Annamalai University, Chidambaram, 2004. Before that, he completed his engineering from Anna University, Chennai. He is Doctor of Philosophy in Mechanical Engineering from IIT Guwahati, completed in 2010. Lakshmanan sir is an expert in regulatory reviews in emergency management and hazard assessment in the field of offsite emergencies framework and nuclear and radiological emergency management. So I request Dr. Lakshmanan to take over for today's lecture. Thank you. Dr. Lakshmanan.
Am I good? Yeah. Good afternoon, friends, and thank you, Dr. Mishra, for the introduction. And I am really happy that we're going to discuss on a topic where you will be given background flavor of and what actually will be the genesis of the regulatory framework for management of radiological emergencies. And I'm really happy that we are having this lecture at probably after all the 31st lecture today, because most of you are now well tuned about the disaster management. Most of the aspects our faculties have taught you many aspects, the fundamental aspects, and I'm very sure that you will be able to appreciate what I will be discussing in today's class, and as well as the coming next lecture. So we'll be discussing in our class today fundamentally what is the planning basis for management of nuclear and radiological emergencies. I would from now I'll call this NRE just for the ease, and then under that we will discuss a few basic things based on which we actually build, or based on for what we actually build the regulatory framework for. So then I'll discuss briefly about the regulatory documents, basically fundamentally the documents that gives or prescribes the requirements and the guidance and how they're structured basically, so that you get a flavor of how these regulations actually help in management of NRE. So then the broad areas the regulations touches upon and from where it is derived, and then I'll take you through the concept of protection of people, what is justified actions, what is optimization during management of emergencies, and how do you do it using reference levels, certain concepts that are being put for the emergency managers to manage the situation as good as possible. And then I will touch upon the hazard assessment and why it is done, and the basically how the graded approach comes in. Yes. And then I will close this today's lecture with emergency planning zones and districts. So the planning basis for NRE. So in planning basis, the first comes the goals of emergency preparedness and response. So the goals of emergency preparedness, this actually Dr. Mishra, S.K. Mishra has already, taught you about this fundamentally what is the goal of emergency preparedness, and I will also tell what is the goal of emergency response as well. So, as part of preparedness, presence of adequate capability for effective response related to delineation of authorities and responsibilities, organization, what is there to be, who is supposed to be taking care, the staffs, coordination among various organizations, various agencies, the plans, procedures that are required for effectively doing, and equipments, facilities, and training. These are part of preparedness that we say that are essential as part of goals of preparedness. And when you come to the goals of response, so the first fundamentally what you see is saving lives, and then how to mitigate the accident and avoid how to avoid certain deterministic and effects, stochastic effects. These are the radiological health effects, which I will also brief you in the coming slides. Then the medical management, then public communication during a response while we are managing emergency, and mitigation of non-radiological consequences, which is a very essential part of disaster management that we have all learned after all the disasters, lessons from all the disaster we have handled, we have experienced, and protection of property and environment. So these becomes the goals of response. So whatever we are going to establish, the regulations, guidelines, whatever guidelines we are going to keep, it is all going to ensure that these are achieved. So with that in mind, I will also take you briefly to what is the consequence, what are the consequences of a nuclear emergency. Because it is important, we should understand what consequence it can bring in, and accordingly our preparedness, our response should be tuned to the consequence that is likely to be there. Then when it comes to nuclear emergency, we have this adverse health effects of radiation exposure, and those are categorized as deterministic effects. And you see, what are those? It's just a harmful tissue reactions due to death or malfunction of cells following high doses. That is at a higher dose level, okay? And I'll tell you when you will get these higher doses. And the other effect is stochastic effect. And as part of stochastic effect, these are defined as cancer heritable effects involving either cancer development in exposure individual owing to mutation of some somatic cells, or heritable disease in their offsprings owing to mutation of reproductive cells. So these we term it as stochastic effects. And for deterministic effects, there is always a threshold of level of dose where you can certainly say that beyond this level of dose, such deterministic effect can happen. And generally, we term this level as 1 millisievert. Okay. Above this, the certainty of deterministic effects increases, and below which we are expecting stochastic effects. So in an emergency, in a nuclear emergency, the most likely effects, most likely consequence is going to be only stochastic effects, and deterministic effects, depending upon the source, it is very limited. So what are we going to address is that these two types of adverse health effects of a radiation exposure we should be addressing during an emergency or during management of a nuclear on radiation emergency. So this is what is our target, that how do we reduce these consequences if there is a emergency. So then there are also non-radiological health effects, that is consequences, which we call psychological consequences. These, reflects apprehension, concerns, considerable fear about radiation exposure among public. So they may also manifest due to lack of public understanding of the scientific data or the health effects. We were discussing about the health effects, right? So understanding this for a normal public, to have a comprehensive idea about this for a normal public is not going to be there in any case. Although these are very, the levels of exposure that you get during an emergency is quite, going to be a limited exposure, but still people would have, for the lack of understanding, they will have to this fear of apprehension, concern about what is going to happen, what is not going to happen, especially in the low dose radiation. This is important. In an emergency, we are going to talk only about low dose radiation. So this is why only low dose? Why not a higher dose? In a nuclear emergency, in a nuclear, a power plant, the design is robust in the sense like it has 5 layers of defense. You all might have understood. You all might have learned by now. And the possibility of higher dose of radiation is completely, avoided. And if at all, if anything is going to release, or any radioactive material has come out of the containment or out of the facility, it is going to have only a low dose radiation effect. So this is very important, that psychological consequence also should be understood as part of consequence. Then there is societal and economic consequence. As part of societal consequence, management of accident itself can bring about social disturbances and disruption of life. This introduces repercussions such as changes in working conditions, living conditions, various restrictions associated with implementation of actions, like we all experienced during the COVID-19 scenario, where restrictions were put to ensure the spread is limited to this part of management of the COVID-19 disaster. And we all have experienced most of us have experienced the restrictions and societal consequences because of the restrictions that are being put. So those are part of consequence of management of an emergency. And then, of course, the economic consequences, we should also understand what are these. These are consequences caused due to economic fabric of the affected area. It could be different for different areas, having direct and indirect impact on the individual. And critical infrastructure such as public transportation, communication systems, food, water could be affected, and these are part of economic consequences. So now we have learned, or we have just understood about the very basics of what is to be addressed, that is goals and consequences. So now I will also want to take you to a very basic, premises of phases following an accident. For a nuclear accident, this is for a large nuclear accident, okay? Say from NPPs, okay? For NPPs, for a nuclear accident that has arisen from NPP, And the phases can be said as early, intermediate, and recovery phase. In this early phase, this is we talk for a few from a few hours to days, max to max around 7 weeks time. That is called an early phase. And then subsequent phase, we define it as an intermediate phase, where it will run from a days to months, in few months, and then you sort of come out of the emergency and then enter into the recovery phase, which is which you call a long-term measures are being taken. And this is the I'm sorry. This is the area where you sort of terminate an emergency, terminate, and this is after declaration. Okay, so first you say early phase, intermediate phase, depending upon, and inside the early phase, you have a pre-release and the release phase. That is, you can declare an emergency even before a release can happen, where it is certainly known that a release will happen for certain, and pre-defined actions can be initiated. So in that scenario, a pre-release phase is very essential, and then it helps. And the release phase, during release, that is any radionuclide releases that are happening from the plant, in that phase, what actions to be taken? This is a critical phase. This is a very important phase during release. What actions to be taken? What is the basis of actions that is to be taken in this phase is important. And once you cross this phase, you'll see in the early phase there is a huge uncertainty. That is, when it is going to release, how much is being released, what are the duration the release will happen. A lot of uncertain informations will be there during an early phase, and the available information will be very low in the early phase of any event. And subsequently, as we progress towards the next phases, we will get more informations are available, and we have already characterized the situation, what has happened, and the situation becomes more certain. So this is how it pans out to be. And why I wanted to say is that this early phase of any emergency is very critical, and every emergency, every disaster has its own characteristics. And especially in this nuclear emergency, that is emergency arising out from a nuclear power plant, again, the early phase, if you are able to handle, or if you are able to do the best in the early phase, and I would say the emergency is handled. Okay, so it is very important what we are doing and what we can do in the early phase. That is, the decision timeframes are shorter, and the preparation is critical in this phase to make prudent decisions when data are lacking or insufficient. And I would also say that, please note that the available response timeframes are much larger in this case rather than like chemical accidents. The time frames are very short. There is no time. I mean, within a short time, the impacts can happen. In the nuclear, for any release that should happen, that can happen from a nuclear power plant, the time frames are in days. Okay, for an event to start in the plant and finally something have to release, then it will take at least 24 to 48 hours, depending upon the design of the plant. And so the time frames are not that short, but then the phase is important. Handling this early phase is important, and that is why we always give focus in our preparedness, how we are prepared in handling this phase. So that is important. So now I will come to the regulatory framework. So the framework is largely dependent upon completely addressing the goals of emergency preparedness and response, and ensuring that all the actions are taken to mitigate the consequences. So that is why I discussed the consequence. What are the consequences? And the need and intent of a regulatory requirement and guidance can be to ensure that the goals of emergency preparedness are met. Guidance are established for response organizations so that necessary arrangements are put in place as part of preparedness. So that is the intent, that the response organizations are able to, make their arrangements well in advance. So certain guidance are being established. Above that, we have specific requirements that are specifically written for various organizations, various aspects of emergency management, and how these requirements are being put and how these requirements are organized and structurally presented. I'll be giving you a flavor on that. So when it comes to the regulatory documents on nuclear and radiological emergencies, so currently in India, the regulatory documents are structured this way. That is, there is one safety code, that is AERB safety code, that is requirement for management of nuclear and radiological emergencies. That is, we call AERB, NRF, SC, NRE. So this code prescribes the fundamental requirements, and then subsequently we have guidance documents that gives guidance to various stakeholders, various plans, facilities, how these guidance, how you can create a system of management of nuclear emergency. So that is the intent of this guidance, and these requirements and guidance are derived from right from our fundamental rules, acts and rules. That is Atomic Energy Act 1962. We have DM Act 2005, National Disaster Management Plan 16 and subsequently revised in 2019, and existing regulatory requirements, ICRP publications, and IAA safety standards. So these are, holistically, all these documents are referred, and the requirements and guidance are basically derived from these things. And you should also understand that AERB is also consolidating and updating the existing guidance. AERB has published over many years very many documents, very many regulatory documents and guidance. And in the field of nuclear and emergency also, documents have been published. But currently, AERB is also consolidating and updating the existing requirements with a clear structure. That is, the guidance are consolidated in form of 3 guides. That is NRE 1, that is a guide for nuclear facilities, and a guide for radiation facilities, and a guide for management of emergencies during transport of nuclear materials. So this is how the current structure of regulatory documents are. So as a participant, if you are going to refer any of these documents, so this is how in the future documents also will be structured. And coming to the presentation of regulatory requirements, how the requirements are presented, how the requirements are segregated, categorized, and presented. First, they are presented as general requirements, then the functional requirements, then requirements for infrastructure. As I was explaining in the beginning, it is all structured this way in order to achieve the goals of emergency response. So the broad areas of requirements, I will take you through the broad areas of requirements, that is the regulatory requirements. As part of, and I will also briefly, get into the depth of a few of these important segments, so that because getting into the depth of every requirement, every aspect will take a lot of time. So for paucity of time, for this level of course, I will only take you through the depth of a few of these, requirements, broad areas. So the coming to the broad areas, we have emergency management system, we have hazard assessment, protection strategy for nuclear and radiological emergencies. So this is as part of general requirements. Then coming to the functional requirements, we talk about the requirements talk about management of operations. How do you manage an emergency? How do you manage the operations during an emergency? And importantly, it also specifically gives the requirements for identification, notification, and activation of response. This is an important aspect that emphasizes on immediate or prompt identification of an event so that the response are taken in time. That is, prompt initiation of response is achieved. So that is the focus of this requirement. And mitigatory actions, and how, what are the requirements for mitigating the consequence on the plant and as well as the general public. What are the actions to be taken to ensure that? And next comes to the protective actions and other response actions. There are certain requirements prescribed as part of when you're taking a protective actions, how that are to be framed, how that are to be evolved, and so that it fundamentally achieves the fundamental goal of justified actions. And then there is requirements on instructions and warnings, protection of emergency workers. Specific requirements are have been put, and communication with public throughout an emergency. A specific clear requirement of clear communication with public during an emergency is also part of the functional requirements. Then coming to the requirements of infrastructure. So as we were initially talking about, as part of preparedness, the first thing is the authorities, clarity in authorities and organization in managing an emergency. So that as part of, so these are captured as part of infrastructure requirement, that is authority for emergency preparedness and response. Coordination aspect, it's a very important aspect of emergency management, coordination between agencies, plans and procedures, logistic supports and facilities for emergency response. And very importantly, training and exercise requirements that will ensure that certain that will ensure that we always test ourselves through exercises, keep on do the continual improvement process, so that we are always poised to do the best effective response if required. And overall, it will also put the requirements on management system for an emergency response. Moving on, before getting into this, I just specify the broad areas of requirements. These requirements basically also, how this advocated, how these requirements are actually taken into the application level is for following the basic radiological principles. That is, basic radiological principles for protection. We all might have already read. That is, the first principle is justification. I put in brackets, that is doing more good than harm. So what does this mean? That is, doing more good than harm is whenever we are taking any actions to protect public, that is, we are introducing some actions to protect public, it eventually will have certain disruptions. So although we wanted to protect public, it will also introduce a level of disruptions. Therefore, when you are introducing any actions to protect the public as part of protective action, it should be ensured that it produces a net benefit. It should not be in a way that the action that we are introducing to protect the public is actually harmful than the actual consequences. That is, it is doing more harm than it can do good. So it should always be ensured that the actions that are being taken is always justified. That is, it does do more good than harm. So that's a fundamental principle, and I'll keep on insisting this throughout the lecture wherever possible, so that I want as listeners, as participant, this message has to be conveyed as part of overall management. Who will be participating or already involved in emergency management, this aspect should be completely imbibed in all of our planning and actions. So next is optimization. Optimization is aimed at achieving the best level of protection through an iterative process. That is, you keep increasing the benefit. Now you have tried to achieve a benefit, but now you are trying to increase the benefit. So when it comes to during COVID-19, certain restrictions were put, right? That is staying indoors, lockdown. What basically it is the term. What is achieved is staying indoors. Stay where you are. Don't venture outside, so that you are physically away from the threat, and then eventually you are mitigating the consequence. So it does gave us some disruptions day to day life, but at the end of the day, it also did more good than harm. That is, it allowed us to protect ourselves from the impact of COVID-19. And although we took our time to adjust to the situation, to manage the disruption, but eventually it did, the net benefit was good. So when you say an action, whether it was justified or not, that is where you have to judge whether it gave it, whether it did more good or it did more harm. So eventually it did more good. It saved people. It saved the infrastructure systems. By that time, what we had, it had many impacts. That what we could handle by that time were limited, and lockdown or sheltering in place helped in achieving that. Whatever infrastructure we had, it is commensurate with whatever number of people being affected, so that it did a lot of good in that sense. So that is how it is a justified action, I would say. Okay. So when it comes to optimization of protection, I'm going to just explain through a graph, what is optimization in a protection when a radiological emergency happens. What happens in a radiological emergency when there is an exposure to a radiation? There is always going to be a radiation deterrent, right? And you will try to reduce this. And as we try to reduce this through restrictions, the social deterrent is also going to increase. So how much you can keep, restrict, what degree of restrictions you can put for the public is where the choice becomes. You should have an optimum level. So the radiation protection level, if you keep on increasing the radiation protection level, the social deterrent keeps increasing. So in any emergency management, this has to be optimized. Then the next concept comes the reference level. The requirements and guidelines, the regulatory requirement framework actually brings in a concept of reference levels. You were taught in the previous class by Shri S.K. Mishra the concept of residual risk. He taught you what is a residual risk. So in the same way, in the similar terms, for the management of nuclear and radiological emergency, we bring in a concept of reference level through which the emergency can be managed better, effectively. So this is a concept where it is in terms of annual residual dose. That is, to an individual, the reference level, the dose that an individual gets after taking protective actions. And it is advised, it is recommended that for emergency planning, you are not planning above this level. A reference level is a level where you should ensure that the doses for the public are below this level. And ICRP identifies 100 millisievert, 100 millisievert as the maximum reference level in an emergency exposure situation. That is, see, you should understand this 100 millisievert, uh, you know. So what it means is that during an emergency, when it comes to, see, you have to follow the principle of optimization, principle of justification, right? To ensure this, ICRP establishes this level that in an emergency, to ensure that justified actions are being taken, a maximum of 100 millisievert reference level can be chosen. It means that you should plan, you should ensure that nobody is getting above 100 millisievert, and below 100 millisievert, you can always do the optimization and keep reducing the consequence to the public, and then as low as possible, you can you can achieve the lowest dose possible dose. So, but the 100 millisievert is a level, and so this is a level that is identified by ICRP as the maximum level. And it also states, see, ICRP also states that any observations of reasonable exceedance of reference level does not necessarily result in a consequence to a public that requires immediate regulatory intervention or a reason for serious distress of public. So what do we learn from this? That is, 100 millisievert dose does not, or even crossing a 100 millisievert dose or exceedance of a 100 millisievert dose during an emergency, because the informations are limited during the initial phase of emergency, you will not be able to actually estimate what is the actual dose the public is going to get. So in that situation, you should have a target of 100 millisievert, and what this 100 millisievert, even crossing this 100 millisievert should not result is that the public need not be seriously distressed by just crossing a 100 millisievert or reasonable exceedance of this 100 millisievert reference levels, or any reference level, or any chosen reference level. Exceedance of reference level, reasonable exceedance of reference level is not a concern. So that need not be, so this should be very clearly understood, and the regulations and the regulatory requirements are clearly putting this so that the public is given the perspective, right perspective, and accordingly the stress, distress, and the non-radiological consequences that can emanate due to the lack of the knowledge or appreciation are highly reduced. So this is going to take the explanation, and accordingly it has to be perceived. So the reference level is going to help in this way in managing a nuclear and radiological emergency. I'll take you quickly, very briefly, to the picture of Fukushima nuclear accident. Just to take you there, which is the recent, or I would say not recent, the last major accident we had the last decade. We all are aware how the situation panned out, how the world perceived it, and currently what is the actual consequence we all have seen it, and we are still understanding better. And in that Fukushima, during that emergency management of Fukushima response, you should note that a decision was taken not to allow any higher doses more than 20 millisievert. This was the decision taken by that time. This decision, you would say, a good decisions in terms of radiological perspective. Yes, they have decided to take or allow only nobody more than 20 millisievert. Good. This is a good target with respect to a radiological perspective. But what happened as because of the choice is that they had to introduce they had to introduce they had to introduce productive actions that are having higher degree of intervention in life. Example, evacuation. I'm sorry. Evacuation. Because of evacuation, we all know the number of lives they've lost directly due to evacuation or indirectly due to the evacuation response. Multiple evacuations had to be done. Elderly people had to be moved from hospitals, and in that course of time, there is it is reported 600 deaths are directly related to the evacuation related deaths. So what finally it has resulted? It did more harm than doing good. So at the end, at the finally, the response was not justified. If a higher level was chosen for the initial response, they would have advised people to just stay indoors, and maximum people would have got a 50 millisievert dose that is of no harm, and then we would have prevented a lot of loss of life, and uh, that could have been a justified action. So what we learned from this is that our actions, we should ensure that always the protective action that we are implementing are always justified. So response actions in the public domain were not planned in accordance with the planned conditions, and the consequence of public was huge, especially on the non-radiological consequences. So the Fukushima response, rather than the radiological consequences, the non-radiological consequences were higher. So this is, I will leave this slide for you for the reference for the future. I will go through the couple of slides. So as I was explaining, the reference level, you start from 100 millisievert reference level. You slowly come down as you know better, as you understand better the situation, and you try to reach the lowest range, that is close to 0 to 10 millisievert. So as you understand, as you go by time to days and months, you understand better the situation, so you keep targeting. But if you start targeting the lowest range in the initial days where you don't have the actual information, then you might be actually introducing a lot of distress, a lot of non-radiological consequences. So the measures to protect public, that is early phase actions, there are certain, the regulations requires certain measures to be taken that while as part of protecting public, that is iodine thyroid blocking, sheltering in place, that's what we call as be indoors, be indoors, that evacuation of people if required, access control, and food restrictions and control. So these are actions that can be taken. This iodine thyroid blocking is a very effective, protective measure. It's a prophylaxis that can ensure that your thyroid doses are, limited. if given at the right time within a short span of time. And these are the actions that are required as part of public protective actions. And the intermediate phase, there are actions that might have to be taken in the intermediate phase after assessment of the situation. There might be a need for relocation. There might be a need for long-term restrictions on certain food items, limited restrictions, and decontamination measures of the affected area, and registration of people, or long-term follow-up for any medical reasons. Then moving on to the hazard assessment, this will be so this I'll be the first aspect that I'll be going in depth of the requirements. One of the requirements I said, a few of the requirements I said I'll discuss in depth, so that we understand that how the basic premises of management is ensured. Management of nuclear and radiological emergencies ensured. So the first part, important requirement that a regulatory framework establishes is the need for hazard assessment. So hazard assessment is very essential. That actually determines the scope and depth of the total program. That is, how much preparedness you should have, how much infrastructure you should have, what is the level of response organization, what is the level of infrastructure, the timelines, the depth of coordination that is required. Everything is actually decided based on hazard assessment. It actually also gives the fundamental idea about the potential, how much potential is there. All facilities will not have the same level of consequence. Each facility, depending upon their source content, will have a different potential of consequence. So when you do a hazard assessment, you will understand this facility will have this much level of potential, and accordingly I need to establish certain level of preparedness requirements. So this is it also gives that, and it also gives an understanding on the technical aspects of what is the likely radionuclides that can come out from this facility, and on-site and off-site areas, likely areas that can get affected. If at all there is going to be any release, what are the likely areas, so that I can be prepared in those areas. I can put some arrangements well in advance to reach the place, to distribute tablets. Such arrangements I can put in place well in advance, so that I do my response very effectively. So hazard assessment gives me that. And then it also gives an important point on the time frames. Hazard assessment can give you what is the timeline I get. As I said, different facility will, generally in a nuclear power plant, after initiating start, if any event that is happening in a nuclear power plant, if it is escalating to a situation that is going to happen a release, it's going to take release in 22 to 48 hours. And so such time frames, based on hazard assessment, you can have such time frames, and you will know what is the time frame available and in what time you should be responding. So that hazard assessment gives all this informations, all this critical informations that is required for preparedness and for response, both. So that is where a detailed hazard assessment is essential. And I'm going to just give a list of you here, in the sense like, a list is identified. You all can go through each one of this. That is, first one is identification and characterization of postulated emergency situations. So for any given facility, you should know, you should postulate what sort of events or emergency situation can happen. This postulation will involve many things. I'll briefly discuss in the next slides. And it will all evaluation of inventories and releases, assessment and distribution of radionuclides. These are technical aspects. Assessment of consequence, that is overall what is the assessment in terms of dose, that is whether a maximum event from this facility can lead to what sort of doses, whether it is 20 millisievert, 50 millisievert, at what distance. So these sort of assessment consequence will come from hazard assessment. And information on time frames and effectiveness of possible protective action. I was just briefing you on that. And determination of emergency planning zones and distance. And as I was saying, that it will also help us in identifying what is the planning distance, to what distance I need to be prepared, so that immediate actions, prompt actions, I can prompt simple actions like distributing tablets, like asking people to be indoors, or if required in few village, in in a small limited area evacuation. By doing all this in timely manner, to what distance I need to plan for. So that comes from hazard assessment. So the first part is identification characteristics of postulated emergency situations. All accidents, internal and external events, including practically eliminated events and events not considered in design, should be considered as part of hazard assessment. A design can design by design, one can say that it is not possible, but as part of emergency management, as part of preparing for an emergency, one should always be prepared for events that are beyond the design, because it is essential that we are prepared for the worst. Just by saying that this is not going to happen will not suffice. So any events, any reasonable events that can happen, even the design is taking care of it, but still you should consider that as part of your planning for emergency preparedness. And you should also always think about combination of nuclear emergencies with other conventional emergencies, flooding, all hazard approach is always there. NDMA is advocating it. And so we should always be prepared for simultaneous hazards attacking us. Like in Fukushima, it happened, there was natural hazard, like natural disaster, tsunami, and as well as there was an event in the plant, either due to the tsunami itself, and we had to manage both. So we should be prepared for such eventualities. Of course, we know how to plan for it. So, and then events that could affect several facilities and activities in a single site concurrently. There are multiple facilities for example. So we should also consider that events can happen in not just in one, two or other facilities also simultaneously. So those aspects should also be taken care. And the regulatory framework insists that the nuclear security aspect is also taken in considered for emergency planning, because most of the time nuclear security arrangements can be having a conflicting nature with respect to emergency response. So we should be very clearly during emergency, how do we still ensure nuclear security, and aspects such aspects should be there. So all this has to be considered as part of hazard assessment. And as part of evaluation of inventory and releases, an evaluation of inventory and releases and the possible release, is essential. And when you know what could possibly release, then your preparedness is even better. So what is the likely radionuclides that can release? You understand, then accordingly your preparedness is ensured. And because when you understand the possible likely releases, you also know what are the pathways, because each radionuclide has a different pathways. To identify most important exposure pathway, you need to understand which exposure pathway is critical, and accordingly you implement protective actions. Then coming to the assessment of distribution of radionuclides and other materials released, this will give you the behavior of the source inside the facility, the radionuclides inside the facility, and what sort of transportation is happening inside, and what is likely to get released. And that is this assessment will give you that. And finally, the assessment of consequence will give you the actual dose or the projected dose. You can actually project a dose, project a consequence, assessment of doses that might be received if no protective actions are taken. So you do this first. That if I don't take a protective action, what is the maximum consequence a person can get? And then what you do? Then you do, if I take certain actions, if I take simple protective actions, how much is the dose I'm saving? How much is the dose I'm reducing? So that is where you do again a protective assessment. Now you understand that. So what is the residual dose the public is getting after taking a protective action? What is the residual dose? So if I was explaining you the reference level, right? So if this residual dose you are able to target, if you're able to keep under your target, then your objective of radiological protection is met. So to ensure this, you need to make an assessment of the consequence. So I will talk how these are done to tools. To in the next lecture, I'll be discussing about dispersion modeling, which essentially helps in doing this. So yeah, I will take you through that. So such assessment is very important in managing an emergency. Then assessment of consequence. Sorry, assessment of consequence. As part of assessment of consequence, you also need to have a fair idea about the non-radiological consequence also. Although it is not, there is no scientific method of estimating a non-radiological consequences, we should always ensure that these is also taken care, and the non-radiological consequences are also addressed. And determining the planning zones and distance. An hazard assessment will give you the identification of areas and locations that would warrant a protective action or other response actions if an emergency is happening. So you already identify certain areas where you can immediately promptly initiate certain response actions and you achieve the target. And during an emergency, depending upon the incident, protective action, see, these zones are for the planning purpose. And during an emergency, you can, the emergency, actually the effect would be much low, limited in the identified zone, or sometimes exceeding the zone as well also. So depending upon the emergency, the actual response can be, during an emergency, this can be changed. So, for an NPP, there is an NPP here, and there is few emergency planning zones and a couple of emergency planning districts identified as part of preparedness to ensure certain pre-planned activities, pre-planned actions are initiated and implemented in a timely manner. So that the first thing is the precautionary action zone and the urgent protective action zones. So these two are the zones where you are prepared to ensure that actions to reduce deterministic doses, that is precautionary action. I was telling about deterministic doses, right, in the initial couple of slides, that is as part of consequence of radiation exposure. If a facility is having a deterministic, having or causing a deterministic dose in case of an emergency, then the regulatory framework advocates that there should be a precautionary action zone where quick actions can be taken to avoid deterministic effects. So that is a PAZ. And next, for taking care of stochastic effects, that is a doses at a lower range, there is a requirement that you establish a urgent protective action zone. So the PAZ is only if there is a deterministic dose that is likely to come from the facility, then you need to identify a PAZ. Otherwise, you don't have need that, and you have a protective action zone where only stochastic effects are taken care. And then you also have an extended planning distance that is for monitoring purpose. How to what distance you should be prepared for monitoring, and there is also a distance called ingestion and commodity planning distance. This signifies to what distance you should control the ingestion or the commodity from that place in case of an emergency. These are preparedness zones that are identified and to ensure that effectively the emergency is managed. And I've already explained this PAZ and UPZ. What is the significance of these two? That is as part of deterministic effects, severe deterministic effects. PAZ, you need to establish a certain zone in order to prevent deterministic effects. And as part of UPZ, the target is risk to reduce the risk of stochastic effects. And as part of the zoning, if any planning zone are large, see, one could always say that, okay, let me be prepared extensively for a large distance, let me be prepared. So the regulation also clearly, cautions the, utilities and the response organizations that there is also a risk of not being able to assign sufficient priority, and this could impede the protection of public in the immediate vicinity of the plant who are at maximum risk. If you are planning for a large distance, if you have already identified large distance as part of planning, so there is always a possibility that we are not focusing a priority to the places where it is actually required, and we might be doing addressing a large area that could not be possible. That is, there is always a likelihood that our resources are constrained during an actual emergency for very many reasons, and we might not achieve what is targeted. So the choice of planning distance represents a judgment on the extent of detailed planning to ensure adequate response. During actual emergency, depending upon the incident, protective actions may be restricted to a small area, to a small part of the planning zone. Actually, it will be only restricted to a small area. The planning distance has to be viewed in this perspective. So just a pictorial view of how do you use these planning zones and your dispersion models or wind conditions. I will be discussing the dispersion models in the next class. But this is just a pictorial view of how to use these zones. For example, there is going to be a wind direction coming in from this direction, and there is a plant here, and the releases happened. And if that particular plant had a potential for deterministic doses, then you try to implement certain actions overall in the PAZ. If the plant doesn't have a potential for deterministic dose, then you don't use this. Then you concentrate on the UPZ, urgent protective action zone. And where you focus? You focus in the sectors opposite here and two adjacent sectors. So that even if there is a change in wind direction, the people who are likely at risk are given protection or rightly advised to either stay indoors or distribution of iodine thyroid blocking tablets or distributed in these areas depending upon the wind direction. And with this simple, this is we call it as keyhole response. With this sort of response philosophy, one can, because you already have planning arrangements. You already know where the tablets are stored, how much time it's going to take to reach these villages, how much teams are necessary to send. Everything as part of planning and exercise you have established in these zones. So when it comes to an emergency, with promptly you will be able to implement a simple protective actions that can protect the public. And if we do this very rightly, and we can we'll be ensured that the fundamental objective of radiological protection is ensured, that is, the justified actions are taken and further optimized. The protection is further optimized to increase the benefit. So now I showed you the phases of emergency. I think the start of the class, I only showed you this block, and now under that you have understood. In the early phase, I said there are certain protective actions that are to be taken. That is urgent protective actions and precautionary actions to address to the risk of stochastic effects, and then early protective actions in the intermediate phase. And to as part of operation of all this, you have certain action levels. I will talk briefly on this in the next class if possible. We have certain criteria based on which certain actions can be initiated. These action levels are criteria that certain actions, once these criteria are identified, certain actions, pre-planned actions can be implemented without wasting any time. So these criteria help us in taking prompt actions. And you also do have to need the capability for survey and dose assessment in the as part of intermediate phase. So I would wind up this class with also with telling you what is going to come in the next tomorrow's class. That is, I will discuss about the elements of decision making and the technologies and the computation tools that are necessary to aid the decision making. So basically, I have explained to you today that how decision making is important in the early phase of an emergency, and how the regulations framework ensures that it is rightly the response organization are prepared for that. And I will also tomorrow I'll talk about weather predictions and dispersion modeling as part of technologies and tools, computation tools. And I will briefly touch upon again on the non-radiological consequences, which is an important aspect of an emergency management, because managing a nuclear and radiological emergency is not only radiological. Our experience in the past, past has shown us a clear indication that we more than a radiological emergency, it is also non-radiological consequences are also to be taken care. I will definitely again spend a couple of minutes to on that. And importantly and finally, I will also talk about the emergency exercise framework and methodology, where the requirements that the regulatory framework brings in to ensure that we are always prepared, and a strong exercise framework and methodology is necessary, that we are always prepared to manage any eventualities. So this is going to be there in the next class. And with that, I will finish our today's lecture. And I thank you for the patient listening. And please comment. Please put your any queries in the chat box. I'll be happy to respond. And we will anyway be collectively be responding also after that also. And see you in tomorrow's class. Thank you.